It feels good to have you back on this channel. And if you are visiting this space for the first time, you are also highly welcome. This lecture will be looking at the gluteus medius. Let's use this image by the side here to illustrate where the gluteus medius is located. This structure that is harrowed here in brown is the gluteus medius. The gluteus medius is seen to be overlying on the gluteus minimus. I've also put up a lecture on the gluteus minimus. If you've not checked up that lecture, please kindly go and do so. But for this class, we would be focusing on the gluteus medius. In this lecture, we'll be looking at where this muscle originates from and also its insertion point. We'll also be highlighting the details that you should know as students of anatomy. The gluteus medius is a fan-shaped muscle that is located within the superficial compartment of the gluteal space. If you remember our lecture on the gluteal region, in that lecture, we said that the muscular component of the gluteal region is subdivided into two compartments. We have the superficial compartment and also the deep compartment. We said that the deep compartment is deeply embedded within the gluteal space, just as the name implies, while the superficial compartment is seen to be overlying on the deep compartment, and this group of muscles are superficially placed. Within the superficial compartment is where we have the gluteus medius, and this is what this lecture will be focusing on. If you try to use this image by the side here, this is where we have the gluteus minimus. This is the gluteus minimus here highlighted in red. The gluteus minimus, we say that it is the most deeply embedded muscle within the superficial compartment of the gluteal space. This muscle is seen to be overlying by the gluteus medius, and this is what is highlighted here in green. This gluteus medius is then seen to be overlying by the gluteus maximus, and this is what is highlighted here in purple. So we see that the gluteal muscles that are located within the superficial compartment of the gluteal space are in layers. So if you look deep, you see that the gluteus medius is seen to be sandwiched between the gluteus minimus and the gluteus maximus. Remember, we say that the most deeply embedded muscle is the gluteus minimus, while the most superficially embedded muscle is the gluteus maximus. So we have the gluteus medius then located between the gluteus minimus and also the gluteus maximus. And this is what is exhibited here in this image. If you go more on the lateral edge here, you have the tensor facial lata. And this is what is highlighted here in yellow. This muscle is also one of the muscles that are located within the superficial compartment of the gluteal space. This muscle is seen to be located on the lateral edge of the gluteal region. And this is what is projected here in this image. In case we are asked during examination to list the muscles that we have in the superficial compartment of the gluteal region, we would be listing the gluteus minimus, the gluteus medius, the gluteus maximus, and also the tensor facial lata. So this is what we have within the superficial compartment of the gluteal space. This group of muscles is then seen to be overlying on the deep compartment. In that lecture, we also listed the number of muscles that we have in the deep compartment of the gluteal space. You can go and check up that lecture to keep yourself updated. So let's drive further to establish the point of origin, also insertion of the gluteus medius. The gluteus medius is seen to originate from the gluteal or the posterior surface of the ilium. This is the bony pelvis, and this region that is seen in this image is the posterior view. So this is the posterior view of the bony pelvis. And we know that the bony pelvis is structurally made up of subunits. So this upper end here is where we have ilium. At this inferior end here is where we have ischium. Remember, we said that this is the posterior view. In the anterior view at the front is where we have the pelvis. So at this upper end here, if you drive deep into the configuration of the posterior surface of the ilium here, because at this region is where we'll be having the gluteal region. So this is also referred to as the gluteal surface. So if you drive deep into this gluteal surface, you see a number of prominences at this region, and these are referred to as the gluteal lines. And these gluteal lines are so named based on the region that they are seen. If you look more inferiorly here, in this region that is harrowed here in red, we have the inferior gluteal line. This inferior gluteal line is the prominence that is created around the gluteal surface of the ilium at this inferior region. So you see that this inferior gluteal line is inferiorly placed, and this is why it is so named the inferior gluteal line. Then we have the anterior gluteal line that is directed more anteriorly, and this is what is harrowed here in blue. So you also see another prominence on the gluteal surface of the ilium that is directed anteriorly, and this is referred to as the anterior gluteal line. Then if you go more behind, just within the gluteal surface of the ilium, you have the posterior gluteal line. So you have a number of lines that are referred to as the gluteal lines, and these are used as the point where the origin of the gluteal muscles will be established. So it is important that we first highlight this line because this will be used as the basis onto which the origin of these muscles will be established. So if you look at this other hand here, let's try and also highlight the pattern by which these gluteal lines are seen. So if you look more inferiorly here at this region that is carved out here in dotted red, you have the inferior gluteal line. Remember, we said that the inferior gluteal line is inferiorly placed, and this is why it is so named the inferior gluteal line. If you go more to the front, you have a prominence that is created around this region, and this is what is highlighted here in dotted blue, and this is referred to as the anterior gluteal line. You can see that this line is directed towards the anterior region, although still within the gluteal or the posterior surface of the ilium. Then if you go more behind here, you have the posterior gluteal line, and this is what is demarcated here in dotted yellow. This is the posterior gluteal line because if you look at it, you see that it is posteriorly placed, although still within the posterior or the gluteal surface of the ilium. So around the posterior or the gluteal surface of the ilium, you can see that we have a number of points that have been marked, and these are referred to as the gluteal line. And this is what will be used to establish the origin of the different gluteal muscles. Because we are focusing on the gluteus medius, our target will be directed towards this muscle. But first, let's look at how the fibers of the gluteus minimus originate. This is where we have the gluteus minimus here highlighted in red. We see that this muscle is seen to be overlined by the gluteus medius. If you look at it, you see that the fibers of the gluteus minimus are seen to originate between the inferior and the anterior gluteal line. Remember, this is where we have the inferior gluteal line here highlighted in dotted red, and we have the anterior gluteal line here highlighted in dotted blue. So in between these two lines, it's where we have the fibers of the gluteus minimus originating from. So if you drive through then into the gluteus medius that we are focusing on in this lecture, this is where we have the origin of the gluteus medius. You see that the fibers of the gluteus medius would originate between the anterior and the posterior gluteal line. So if you want to drive into the details on how the fibers of the gluteus medius originate, it originates from the gluteal or the posterior surface of the ilium. But specifically, the fibers of this muscle are seen to originate between the anterior and the posterior gluteal lines. Remember, we already carved out how these lines are created around the gluteal surface of the ilium. So you see that the fibers of the gluteus medius would originate between the anterior and the posterior gluteal line. And this is the specific point where the fibers of this muscle originate from. And they are finally inserted on the anterolateral surface of the greater truncator of the femur. And this is what is seen to be harrowed here in black. So you see that after their origination from the posterior or the gluteal surface of the ilium, specifically between the anterior and the posterior gluteal lines, their fibers are seen to converge inferiorly and are inserted on the anterolateral surface of the greater truncator of the femur. And this is what is harrowed here at this point. So this is the details on how the fibers originate and also where they are finally inserted upon. So now let's go to the actions of this muscle. This muscle is seen to help in the abduction of the thigh and also medial rotation. It is also seen to help stabilize the hip joint. If you look at the pattern by which the fibers of the gluteus medius run from where they originate from and also their insertion point, you see that they are seen to cross over the hip joint. And due to this cause, they are helping to stabilize the head of the femur within the acetabulum. Because this is what you have deep to this muscle. The blood supply of this muscle is the superior gluteal artery. The superior gluteal artery is one of the branches from the posterior trunk of the internal iliac artery. And this is what gives supply to the gluteus medius. The gluteus medius is seen to be innervated by a corresponding nerve, and this is the superior gluteal nerve. The superior gluteal nerve is one of the branches from the sacral plexus, and it is specifically seen to originate from the dorsal divisions of the ventral rami from L4 to S1. So this is how it specifically originates from the sacral plexus. So thanks for watching this video. Let's continue to stay glued channel.